I'll be spending the next half an hour speaking on emergency obstetrical ultrasound in the first trimester. Um, the major reason for doing an emergency obstetrical ultrasound in the first trimester is to evaluate a woman who has bleeding or pain or both. When we do an emergency ultrasound in this setting, what we're looking for is to determine really whether the pregnancy falls into one of three categories. It may either be a normal intrauterine pregnancy. It's not too unusual for women with normal pregnancies in the first trimester to have some bleeding or pain. The bleeding is sometimes called implantation bleeding, but really it can be a normal feature. Second possibility in a woman with first trimester bleeding or pain is that she has an intrauterine pregnancy, but it's abnormal. It may be a failed pregnancy, also termed a spontaneous abortion, or one that is on the way to becoming a failed pregnancy or a failing pregnancy. And the third possibility is ectopic pregnancy. So what you're going to hear for the next half hour really is how we make the diagnoses of an abnormal intrauterine pregnancy or an ectopic pregnancy. When we do a first trimester ultrasound in a woman with symptoms of bleeding or pain, the key questions when we're doing the ultrasound are, number one, does the ultrasound demonstrate an intrauterine gestational sac? If it does, are the sac and its contents normal? And are the adnexa, the structures outside the uterus in the pelvis, are they normal? There's a fairly straightforward algorithm about how we use the answers to these three questions to arrive at a diagnosis. So you can see that the first question is there an intrauterine gestational sac identified on ultrasound? If the answer is yes, we then try and determine if the sac and its contents are normal. I'll get into how we determine that in a minute. If the answer to that is yes, there's an intrauterine gestational sac, and yes, the sac and its contents are normal, then our diagnosis is a normal intrauterine pregnancy. At least as far as we can tell on ultrasound, everything is fine. If the answer is yes, there is an intrauterine sac, but no, the sac and the contents are abnormal, then the diagnosis is an abnormal intrauterine pregnancy, either definite or possible pregnancy failure. And I'll be expanding a lot on this one in just a minute. If the answer to is there a gestational sac in the uterus identified, if the answer to that is no, we don't see one, then the key question becomes, is there a complex or solid mass in the pelvis outside the ovary? And we'll see soon why it's very important that that the mass that we're determining presence or absence of is outside the ovary. If we do see such a mass, if we see an extraovarian complex or solid mass in a woman who is pregnant, has a positive pregnancy test, but no intrauterine gestational sac, then our diagnosis is an ectopic pregnancy. And finally, the final branch of the algorithm, if we see no intrauterine gestational sac and no abnormality in the adnexa, then we have the same differential diagnosis we started with. It's either a normal intrauterine pregnancy, an abnormal intrauterine pregnancy, or an ectopic pregnancy, and that's going to require further follow-up. So the rest of the talk will be really devoted to expanding on the various branches of this algorithm. We diagnose an intrauterine pregnancy when we see one of three things. If we see a fluid collection in the uterus that contains inside of it an embryo with a heartbeat, as you can see here, that means that this is an intrauterine pregnancy. If we see a fluid collection in the uterus with a little circle in it representing the yolk sac, that also indicates that we're looking at, and that there is an intrauterine pregnancy. A third finding of an intrauterine pregnancy is a fluid collection inside the uterus with a double echogenic ring around it. This is called the double sac sign, and it's another ultrasound demonstration or another ultrasound proof that there is an intrauterine pregnancy. Now, we do have to be careful, though. There's something that we might term the pseudo-gestational sac, which is when we see fluid in the uterus in a patient who's coming in to rule out ectopic pregnancy. There might be a tendency when you see some fluid like this with no embryo, yolk sac, or double echogenic ring to say, oh, that's just a pseudo-gestational sac, and therefore the patient probably has an ectopic pregnancy. This is a small fluid collection in a rule-out ectopic patient. But if you look what happened to this particular woman, a little over a week later, we see a pregnancy. You can see the yolk sac, the heartbeat, and then about 3 weeks later, you can see a nice normal intrauterine pregnancy. So this small fluid collection, don't think that you're seeing a pseudo-gestational sac. Not all gestational sacs have the one of the three characteristic appearances that I showed you on the prior slide. So overall, anytime you see an intrauterine fluid collection in an early pregnancy, even if it doesn't meet one of the criteria of having an embryo, yolk sac, or double echogenic ring around it, give it the benefit of the doubt. It may be an intrauterine pregnancy. There's a good chance it is an intrauterine pregnancy, even if it doesn't meet the one of the three criteria. So let's now move down to the situation where we move in our algorithm. We've done the ultrasound. We've asked the question, is there an intrauterine gestational sac? And the answer is yes. So then what we have to determine by ultrasound are whether the gestational sac and the contents of the sac, whether they're normal. To answer that question, I've put up this table that lists many of the published norms for the gestational sac in early pregnancy. For example, as a function of gestational age, the normal findings, if one is scanning transvaginally, include the following. At 5 weeks, you expect to see a gestational sac with a double ring around it. At 5.5 weeks, you expect to see a gestational sac with a yolk sac. And at 6 weeks, you expect to see a gestational sac with a heartbeat. There are norms also as a function of the mean sac diameter. For example, when the mean sac diameter is 8 millimeters, you expect to see a yolk sac. If it's 16 millimeters, you expect to see an embryo. And there are norms also with respect to the pregnancy test, the beta HCG level, the crown rump length. For example, by the time the crown rump length is 5 millimeters, you should always see a heartbeat. You actually see it very often before it's 5 millimeters, but you should always see it by 5 millimeters. The yolk sac should be less than 6 millimeters. There are norms for the heart rate and others. So to know whether the sac or the gestational sac or its contents are normal really means knowing this table. If a pregnancy meets all of the findings in this table, the gestational sac is normal. If it fails to meet one or more of these, we are concerned about an abnormality.